Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College and Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and Site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, December 12th, 2022. Thanksgiving kicked off a new COVID surge, and it's slamming U.S. hospitals already battling the TRIPLE-DEMIC, and it's the perfect storm for a terrible holiday season. As we move out of Thanksgiving towards the Christmas holidays, COVID conditions are worsening across the country, with reported cases, hospitalizations, and deaths all up on more than 25% in the past 2 weeks, and test positivity rates rising quickly. While the current winter surge is milder so far than at this point in previous winter waves, its nationwide scope is concerning. Since Thanksgiving, all but 4 states have seen hospitalization counts increase. New daily average death counts also are up over the past 2 weeks from 250 to 350 per day. Today, I'm going to talk about the current COVID surge we are experiencing and then discuss it within the context of the concurrent surges in flu and the RSV epidemics that we also are witnessing. Then I'm going to provide an update on the status of vaccines for children under 5 years of age. I will follow that up with an update on new COVID cases, hospitalizations, and deaths, both nationally and in Tennessee. So let me start by talking about COVID. The BQ.1 and BQ.1.1 subvariants taken together are now responsible for 68% of new COVID cases, according to data published by the Centers for Disease Control and Prevention. The XBB subvariant is a cause of an additional 4.7% of new COVID infections. Scientists have described the XBB and BQ subvariants as more adept at evading immunity from vaccination and infection than prior versions of the virus. They pose a significant threat to people with compromised immune systems because key antibody treatments are now resistant to them. The Food and Drug Administration last week pulled bebtelovimab, a monoclonal antibody used to prevent people who catch COVID from developing severe illness. Bebtelovimab was used by people who cannot take other FDA-authorized treatments, such as the antiviral Paxlovid. Many people with weak immune systems, such as organ transplant patients, cannot take Paxlovid with their other medications. The BQ and XBB subvariants also are resistant to Evusheld, an antibody cocktail that many people with compromised immune systems rely on for protection because they do not mount an adequate response to the vaccines. The FDA still authorizes Evusheld for use. Let me turn to COVID, flu, and RSV. This year's flu season is off to an early and dramatic start. And with COVID and RSV, it's a perfect storm for a terrible holiday season. The U.S. is seeing a post-Thanksgiving surge in COVID cases and hospitalizations, according to the U.S. Centers for Disease Control and Prevention Director, Dr. Rochelle Walensky, an expected but concerning development, with hospital capacity already stretched thin by epidemic levels of flu and RSV. The rise is especially worrisome as we move into winter months, when people are assembling indoors with less ventilation. It's more concerning given upcoming holiday family gatherings involving the elderly, who are at higher risk for severe outcomes from all respiratory illnesses circulating at high levels this fall. Last week, 77% of U.S. ICU beds were occupied, according to Johns Hopkins University. Most of those beds, nearly 56,000, are occupied by patients who don't have COVID, while just 4,000 are occupied by those who do have it. Levels of flu or flu-like illnesses also are high or very high in 47 U.S. jurisdictions, up from 36 last week. Since October 1st, the U.S. has seen nearly 9 million confirmed cases of the flu, nearly 80,000 hospitalizations, and 4,500 deaths due to this disease. During the last full week in November, flu hospitalizations nearly doubled over the week prior, according to CDC data. And RSV levels remain high nationally, although there are some signs that they may have peaked in the South and Southeast, according to Walensky. U.S. COVID hospitalizations began trending dramatically upward after Thanksgiving, particularly among those ages 70 and older. The current 7-day average of COVID hospitalizations sits at 4,650, according to the CDC, up 27% from the week prior. U.S. hospitals are already under immense stress this fall, with epidemic levels of RSV and flu in the country, in addition to COVID, forming what experts are calling a triple-demic. COVID and flu hospitalizations are increasing across the country, while RSV is retreating in some states. You can get really sick this year and ruin your holiday celebration if you don't get the COVID vaccination. Those eligible to receive their Omicron booster and their flu vaccine can safely receive both at the same time. Even those who've already had the flu this season should still get vaccinated if they haven't already. Multiple variants of the flu are circulating as usual, and it's possible to get it multiple times in one season. Persons feeling sick should test themselves for COVID and arrange for a flu test if their COVID test comes back negative. Antivirals like Tamiflu for flu and Paxlovid for COVID are available via prescription, but must be taken early in an infection to make a difference. CDC Director Walensky also recommended that residents of the nearly 6% of U.S. counties with high community levels of COVID mask up, in addition to those who travel by plane, train, and bus, and those who are immunocompromised or at risk for severe disease. Community levels is a measure the Federal Health Agency determines by looking at new COVID hospital admissions in a county, in addition to the percent of staffed beds in use by COVID patients. Per this metric, nearly a quarter of U.S. counties have median community levels of COVID, and nearly 70% have low levels. Community level difference from community transmission of COVID, which the CDC determines by looking at the number of new cases reported to public health officials over the past week, as well as percentage of lab-based COVID tests returning positive. By this metric, more than half of the country is seeing high COVID transmission, while more than a quarter is seeing substantial transmission. So let me turn to young children. The FDA authorized the Pfizer and Moderna vaccines for the country's youngest children in June, a move that came a year and a half after the vaccines were rolled out for adults. But few young children have been immunized since then. Only about 13% of Americans ages 5 and up have received one of the new doses so far, with less than 10% of the children ages 4 and under having received their first vaccine dose, and even fewer have completed their full vaccine series. The Food and Drug Administration last Thursday expanded eligibility for the updated coronavirus shots to children as young as 6 months of age, the latest step to make the retooled doses available to more Americans. The federal government rolled out the updated boosters from Pfizer, BioNTech, and Moderna in September, though the public has shown little interest in the new shots. The government expanded eligibility to children as young as 5 in October. The new action by the FDA further expands access to the so-called bivalent booster. However, only a small fraction of the country's youngest children have been immunized since the original vaccines were authorized for that age group nearly 6 months ago. Young children have been hit hard in recent months by respiratory syncytial virus, known as RSV, with cases swamping pediatric units across the country. And this year's flu season is shaping up to be severe. More than a dozen children have already died. For the country's youngest children, eligibility for the updated COVID bivalent booster will vary depending on which vaccine and how many doses they have previously received. Children ages 6 months through 5 years who have received Moderna's 2-dose vaccine will be eligible for the company's updated booster 2 months after finishing their initial vaccination round. Pfizer's vaccine is given as a 3-dose series for children ages 6 months to 4 years. For those children, the 3rd dose in the series will now be the updated shot instead of the original formulation. Young children who have already received all 3 doses in Pfizer's series will not be eligible for an updated booster. But the FDA said it expected that new data would be available in January concerning the retooled booster for that population. And the agency said it would assess that data as quickly as possible. The broadened eligibility for the updated shots still needs to be signed off by the Centers for Disease Control and Prevention. Nationally, COVID cases, hospitalizations, and test positivity rates are seeing substantial increases at the national level, as we have heard as we head into the Christmas holidays. Over the past 2 weeks, COVID cases 56% nationally to over 65,000 per day, or 20 per 100,000 of the population. Likewise, hospitalizations and test positivity are both up 28% from the previous 2-week period. ICU admissions are up 22%, while the average daily death count increased 40% from 260 to 466 over the previous 2 weeks. Hospitalizations are now over 38,000 per day. ICU admissions are over 4,300 per day, and test positivity is now at 12%. Higher test positivity rates are a sign that many infections are not reported, even if they are tested for at home. This results in a more severe undercount of cases. The number of hospitalized patients with COVID is a more reliable measure because testing is more consistent in hospitals. In Tennessee, there's been a significant surge in new reported cases of COVID, hospitalizations, and deaths over the past 2 weeks. Tennessee currently ranks number 16 among the 50 states for newly reported COVID cases. An average of 1,376 cases per day were reported in Tennessee over the past 2 weeks, more than double the average 2 weeks prior of 541. Meanwhile, hospitalizations increased by 48% over the prior 2-week period to 627 per day, and ICU admissions increased by 12% to 65 per day, while test positivity increased to 14%, a 35% increase from the prior 2-week period. Meanwhile, deaths more than doubled, up 103% to 14 per day over the past 2 weeks. The infection rate in Tennessee is now at 1.21 per 100,000 of the population. There are now 4 counties in Tennessee that are in the red zone, compared to 0 in the prior 2 weeks. Tennessee counties in the red zone include Washington, Unicoi, and Carter counties in the far northeastern region of the state, and Tipton County in West Tennessee. There are now 24 counties in the yellow zone, up from 17 counties 2 weeks ago. 13 of the counties are in West Tennessee. 2 counties, Macon and Dixon, are in Central Tennessee. 6 counties are in South Central Tennessee, while an additional 3 are in Northeastern Tennessee. It's now clear that the winter surge has come. There is still time to get vaccinated prior to the Christmas holidays. Protect yourself, loved ones, friends, and colleagues, and get boosted. For now, this is Dr. Paul Juarez from Tennessee SEAL and HealthWorks, wishing you a good day and a happy holiday season. Be safe.